One of the things that inspired me to become an orthopedic surgeon is that I think I like to make a tangible difference in people's lives. So when people think of orthopedic trauma, I think they think of the complex, multi-injured, poly-injured people in the intensive care unit. And that's part of what we do, the complex care that no one else in the region can provide. But I think there's a different level of care that we provide as well. Something maybe a little bit more simpler, if you will. People who break their ankles, break their elbows, break their wrists, we still provide good quality fracture care. It's part of the reason we renamed the division the Orthopedic Trauma and Fracture Service. It's because we do comprehensive care for the patient, not just the polytrauma patient, but the weekend warrior who breaks their ankle. There are a lot of things that we do on the Penn Orthopedic Trauma Service that are unique, that are not typical fracture things. Things like pelvic and acetabular fractures, where we're able to reconstruct the hip socket. Things like being able to lengthen individuals' limbs that have been shortened because of trauma. Being able to restore not just a couple millimeters of bone, but 10 to 15 centimeters of missing bone. One of the hardest things about what I do is saying goodbye. Patients break their legs or break their arms, and eventually they heal. And when they heal and they're back to their sort of normal life, they don't need me anymore. And one of the hardest things about what I do is actually having to say goodbye. I'm Dr. Samir Mehta, Chief of the Orthopedic Trauma and Fracture Service at Penn Medicine.